Hi, I'm Ahava. Today I'm joined by my good friend Amanda Oleiro, the Director of Brand, Creative, and Content at University of Missouri Healthcare, to talk about the latest in healthcare content. You've got questions, we've got answers. Let's dive in. Amanda, first of all,
Good style, great minds. I love it.
it's awesome. It's really, really awesome.
Actually, an honor to be dressed like you.
I love Amanda. If you've ever had the chance to hear Amanda speak, run. I want to talk to you about your work at MU Health because you're doing some really interesting things there. So I want to dive into that for those people who want to also be doing interesting things. You've developed a centralized system for content intake at MU Health, from physician onboarding to trending topics. God bless you. What does your idea generation process look like, and how do you keep it from becoming chaotic?
Yeah, so this was years in the works. The first thing, get the right people into your inboxes. Get them to the right inboxes. That was the first step. So we have lots of service lines. We have lots of clinics. We have lots of hospitals. And randomly, someone would email this person or that person. And so we worked really, really hard to get them into our marketing strategist inboxes. Every service line has a designated person. That is your go-to. We drill it in. We keep doing that. Even when they email me, because somehow my name is attached to some social media thing, they're like, Amanda, I'm looping in your strategist. So that's one point of entry. And then that strategist will take it then to a sifter form. So then we have it, it's coming into this thing. Sometimes it comes through PR. There are ways that might happen, maybe a media availability. Also, PR is on crisis communication, so we know that. But it all goes into a sifter form. So that was our first step. Let's get that process in the works. Then we had to get the right people in the right room. So every week, once a week, we all meet, and this is marketing strategists, it's PR, it's internal comms, it's communications, it's the marketing people. We're all in the same room so that we can go through those sifter forms.
How many people is that?
It's probably about 20, and it's a good room. It's a good group. We go off the rails, but we have some great conversations. But we all bring it back because that sifter form's there to re-listen, right? And so there are good questions.
I would fly out just to be a fly on the wall. That would be unhinged.
Yes. We always bring it back though. I have one of my coworkers, he leads the meeting and he's the best at being like, well, okay, rein in his guys. So you do have to have that person. So yeah, the sifter has basic information. It's going to have the background. We're going to try and pull it in that sifter form itself. We'll have, does it hit these differentiators or these reputational things that we know are guardrails for us? But we all go through it together. And so that's where anyone in the room can kind of be like, ooh, yes, I want a piece of that. Or did we think about this one thing? Or we've already got this scheduled. And so it's really nice to have everyone in there so we can make decisions really quickly. And it's been really cool too, because we used to have things where maybe someone was like, oh, can you please do a social post on this one thing? And PR is like, what the heck, this could have been much bigger, or vice versa. We'll have things where like maybe a physician went and spoke at a conference and they're like, can we do a recap post? So we sift it. And it's like, well, what's the conference? Surprise, it's a Super Bowl conference, right? It's our neurologist got picked to go to the Super Bowl. And so that's a press release. That's monitoring to see who else is doing it. That is thought leadership in the works, And so we started really getting those conversations working around that. And then within that, we also have a project manager in there. So she's there now. We just got her. It's the best thing ever because there are all these ideas. And the next week we come back like, wait, what did we say? So she's there taking notes. Okay, it's a social post. I'm going to assign that. Okay, it's a blog. It's going to be this. She's the one working. What website needs to be updated? So that's containing all the chaos for us, which has been really, really helpful. There's other entry points too. So that's kind of like as things come, what are we doing with it all?
That's still amazing. Now, how did you get the executive buy-in to do that?
The good thing is at MU Healthcare, marketing, communications, PR is all under one executive. So that has been very, very helpful. But also we have buy-in from other leaders of just, they want the reputation, they want those things. We have some buys for the news, we have some others. So it's that high profile stuff. And when they were wanting to crank it out, we're like, the best way to do it is to be sure that we have this time, these resources, even from the project management system. It was kind of like, we can do this faster and better if you can buy in. And so we had good buy-in there.
That's genius. Implement that immediately.
Yeah. One of my favorite one too is if we would have kept the old system. So it was also showing the success stories, right? So if we would have kept the old system, someone would have been like, hey, our 7T MRI is now accredited. Can you do a press release? And on the surface, our PR manager would have been like, absolutely not. The news does not care about accreditations. But it came to that room and we're like, okay, but like, what does that mean to be accredited? And they're like, well, I don't know. And like, we have a 7T and we have one of 40 in the world. We've been told it's the most powerful in the world. And we're like, tell us more. And so we're kind of like starting to weave it out. And it was basically, in order to get accredited, you have to have enough images. And those images have to be strong enough to be showing your work and be like, hey, FDA, approve it for this use because we have these images and it's showing it correctly. We started to learn we were the only health system in the world who was able to use it for clinical purposes that much to start getting those FDA approvals. And the reason we were is because we're an academic health system and we had the engineers in the room who could calibrate the machines appropriately to get the image. So it was really cool to be like, okay, as soon as we started to unravel that idea would have died back in the day. But because we had that group of minds all together, we were able to act on it. It was a thought leadership piece. It was a Live Healthy article. We pitched it. We got picked up across the nation for little industry papers. So it was a lot cool.
That is a great story. That's a really,
Yeah.
really great story. Good for you. Congratulations.
Yeah.
All right. Many health systems aim for SEO dominance, even though some big players own it already. You've taken a different route.
Yeah.
What's your philosophy on finding and owning your niche instead of chasing the top dogs?
I love this question because I'm really proud of what we've done. But I think the biggest thing is you can't make it up out of anywhere, right? Like to find your niche, it still has to be based in strategy. It still has to be for your brand reputation and all that stuff. We were kind of looking at the big picture to say, you know, consumer perception, we do consumer perception studies every 2 years. And every time we looked at it, we were like, yep, MU Healthcare is known for teaching the next generation, having the best tech, advancing medicine. But the quotes we would get from people would be like, that's where you go when you have something really wrong. And we're like, yes, but we also are really there for you throughout your whole spectrum of life, health and wellness. We're there. And also we have really cool people. So one of my favorite things our CEO said when he first came to MU Healthcare was you can't walk 15 feet without tripping over someone really cool. And it was true. So I was like, hey, we have these really great doctors. Like they should be known for more than that. And we already were fighting the like big systemness, right? So we're like, okay, we want to be able to do the full spectrum and we want to be humans while we're doing it. So that was going to be our niche. So we really wanted to take on this approach of we're going to take topics that people are really asking about it and how they're asking about it, even if they're uncomfortable topics. And we're going to put humans to it. So you get their real quotes, you get their real voices, and then not chase this perfectly optimized headline. And the other part was they already had that. So we were going to leverage it. If you think about the journey, it's do I have this symptom or this disease? And WebMD is going to say it's cancer 90% of the time, but Cleveland Clinic's going to help you out. They're going to give you some proper stuff and they're going to run you through all of it. And then they're going to be like, and here's how you get treated, right? So they got that. Check. We'll leverage that. And our website is like, hey, you already know you probably have it. Here's how we can diagnose it and what you treat. Check. We have that. That's what our web pages do. So then it's the whole, but what does this happen? Or what if I get called back after a mammogram? Great. Now we have the content that's going to answer it for you and have a really nice voice to it.
Yeah, you're anticipating not the surface level questions, but moving them down into the funnel. That's fantastic. Can you give me an example of a topic that you worked on that was a little uncomfortable and how you managed it, both pitching it within that big room that you talked about earlier, and then also like how you got the doctors to give it a human voice and tone?
Yeah, I think there's quite a few. One of my favorites is pelvic floor therapy. I had a baby. I have the privilege of being one of these target audiences. Is like, you're going to have a baby and things are going to not work the way, right? And so if you think about it, there's great content on what is pelvic floor dysfunction. You'll go to Cleveland Clinic or Mayo. They'll tell you exactly what it is. You'll talk about therapy and they'll have the journey of where you should go and all of that stuff. But as a woman, you're like, yeah, I could go and maybe I did go, but maybe I didn't like it or maybe it didn't work, or I'll just read about Kegels. And then you're going to get discouraged because chances are they might not work. And so we didn't have an article that was like what you should know about pelvic floor therapy. We said, Kegels don't fix everything. Here are surprising facts. So we empowered women and we have really great trained therapists. And they're like, yes, we talk to our patients all the time. They always think it's Kegel. That can actually make it worse. And I was like, okay, let's talk about that. And so it was giving that more like, we hear you, we see you, we empathize with you. Maybe some more tough topics to get approved. And this was a fun route was in Missouri, marijuana got legalized 2 or 3 years ago or so. And that was a topic that was like, ooh, like, are we talking about it? Are we not? And so a lot of people are asking, is it legal? We were like, what's the next phase of that? It's legal, but is it safe? And so that was one that just as a leader, I was like, you know what, the best route is to go get it written and then have people react, because permission on the surface isn't going to work. But when we had a really passionate primary care doctor, we told him from the start, hey, we want to talk about this, but it may or may not be something that gets published. So we wanted to set that expectation. And he gave such good concrete advice. And so we went through that and then we got it approved. Everyone read it and they're like, yes, it's practical. Yes, it sticks to our brand. Yes, we're positioned as experts. And it was easy to understand. So we did that as well.
That's awesome. I think it really speaks to the whole thing about, we think of keywords as these like very like general type of ideas and just these like big terms, like what is a heart attack? That's not really what people are looking for.
Yep.
You know, why is my heart beating so fast? Or like, why do I have pain in my chest? Or I have pain in my arm? Like those are really the things that they're looking for.
Yeah. And you asked how we got buy-in from doctors to maybe take that approach. Yeah. Again, it's been really cool actually, because a lot of the topics we're choosing for those hard ones like erectile dysfunction or sexual health, they have that conversation so many times. To them, it's just normal. And so they want to normalize it. They almost want to partner with us to be like, absolutely, yes, this is important. So it hasn't been that much work either to get their buy-in. And then when we write it that way, the patient or the reader can get a sense of their bedside manner, which has been really powerful as well. We still get some people who are like, oh, my peers might read it and it needs to be in this. And we just go back to we have a lot of rules and guidelines. Eighth grade reading level needs to be plain language. All other things as writers, we know for sure. Most of the time, if we remind them of that, it's not a big fight.
Yeah. I also think like the greatest place to take shame out of something is the internet, because it's just somebody with a screen. You know what I mean? Like it doesn't have to feel puritanical on any level. Like it's not a cocktail party where people are talking about erectile dysfunction. It's somebody looking it up. So I feel like we're very lucky that we live in an age where you can find hopefully good advice. And the fact that, it's being published by doctors really adds credence to it. Use Live Healthy content is thriving and people also ask an AI overviews. So anybody listening to this is very jealous of you. Even without SEO as a core focus, which I want to dive into, why do you think that strategy is winning right now?
I think, again, taking that human approach, taking a step back and just being like, what are they actually feeling or what are they thinking or what is the next layer? So I went and I pulled our data right before this and I was looking at the articles that are, thriving in there. And one of them is called back after a mammogram, X things you should know. Because we know that they already are looking at what should I do before a mammogram and all this. But then they're, oh my God, I got called back. And immediately they're not getting called back to come in that day, right? They're going to have that wait time. And so they're Googling. And so it was like, here you go. And most of the time it's not cancer. And so it's that comforting piece of it. Other ones where my favorite one that we've pulled from a random interview was growing pains aren't real. So there's a lot of questions like, if I have pain in my growing, and we're like, they're not real. And they're like, what? And so we had this article that just grabbed their attention. And that was one that we were doing a patient story on juvenile idiopathic arthritis. I was like, how do you tell the difference? Again, I'm a human. I asked a question, so other people are going to be asking it. And she was like, those aren't real. That's a misnomer. And I was like, wait, what? And so she walked us through like mechanical things and child development. And I was like, yes. So that one's cool. The other, again, a lot of these are inspired by my life. So I get to be the target audience. But the other one that is just killing it is joint pain in your 30s and 40s.
What is up with that?
Because most people are like, why do my joints hurt? And if you do anything on joint pain, it's going to be 60s, 70s, osteoarthritis, all of that stuff. And I'm like, no, it's hitting us much earlier. So we found that niche, we found that little corner. And so it's just been really cool to just be a human. And I think that is what's winning the AI game right here is you can optimize all you want and try and beat the robots. But at the end of the day, humans still have human questions and we got to answer them.
What are you excited about right now in healthcare marketing?
I'm really excited that the AI game has caught up to this approach and all of those things. I think that that's really exciting. I think it's really cool to keep pushing just that plain language part of things. Again, I think with the internet and with all these things, and I know there's distrust in all of this stuff, it's really forcing us to put a better lens on the content. And I think that is really exciting to see just how we can deliver, how we can keep getting better at these topics. Again, just putting expertise to it. I'm such a nerd for the data and the information and all of that stuff. And so to be able to turn that and actually have people benefit from it, I think that's really exciting.
Yeah, I agree with you. Do you talk about vaccines?
We do. So we've done quite a bit. There's been a few topics that we've done there, maybe some of the non-fun ones. One of them, you're probably asking about COVID or flu, and we do those as well. But one of mine was HPV vaccine. That was another really fun article we've done because we want to push, our appropriately pediatric vaccines and all that stuff. But then it all came out with adults can get HPV and all that stuff too. But knowing the human side of it, there was this stigma, right? Of, well, my kid's not having sex, so they don't need it.
I fell into that trap. That's what happened to me when my pediatrician first recommended it for my daughter. I was like, well, she's not there yet. She's 12. And she was like, well, let me walk you through it. And so I understood it better. I have 2 daughters and then I have a son. And I didn't realize that boys also get vaccinated, which is really pathetic because I'm a medical writer. Like I really should have known that.
Yep.
When she introduced it for him, I'm like, wait, what? And she said to me, he won't put any partners at risk. And I'm like, great, awesome. I don't think like that's a conversation human to human. And I did leave for office and research it the first time she recommended it to me. So I think it's really important. And people, just because they have a reaction of like, I don't know if I want this, it doesn't mean that they're crazy or that they are against government regulation. It means that they care about their children and they want to make sure that they're doing the right thing for them.
Yeah. And so we knew that we were getting with male, we were having a lot of throat cancer. HPV related throat cancer. So again, we wanted to put that in there. And our main headline was, you don't have to have sex to have HPV. So that one, I mean, that we wrote that probably 3 years ago. It still ranks in our top 5.
100%.
We've also done content, especially when COVID was first coming out and all the vaccines. We had a breakdown of like how mRNA vaccines work. And it was really important to put it in that plain language because there was plenty of CDC articles out there and we reworked it to make it more of a metaphor. And I remember our infectious disease doctor, I still have it printed in my office. She was like, this work is so important. Like, this is how we help people have confidence in their decisions. It's content like this and language like this. And so that was really powerful to see too.
Yeah. And I also think the other thing that we don't think about, but for the people that are curious and want to learn and have an open mind, you have a chance to then affect their ability to talk to their friends who might not be as open-minded. and have that nuanced conversation about, well, you're right. My kid isn't having sex yet, but when or if he does, I want to make sure that A, he can't catch something dangerous, and B, he can't pass it on to somebody else. Like, I don't want him to get throat cancer. And just hearing that, I think it's like you're saying, speak to humans on the page, recognizing that they're going to speak to other humans off the page. It's like a beautiful cycle.
We've also, a lot of our articles too, try to equip the reader with questions they can ask their doctors for like a productive conversation too.
Yes.
So we even have like questions you should be asking your primary care provider. Are you taking too many medications? And that was one that like our team was kind of like, oh, is that like, we can't say that. What if it? And it was like, no, there's polypharmacy. And we have a lot of patients who, we have a rural population. And so while in Colombia, we might think like everyone's here, it's all connected. They all like, it's all the same system. We have a lot of people who might get care from an urgent care or a primary care clinic here or a hospital here, and they're not all connecting. And so it was this beautiful conversation to just be like, check your list. And a lot of people were like, yeah, check your list, bring it. But it was kind of like, let's ask your doctor, how long should you be taking that? Because a lot of people get prescribed it and it's meant to be short term and they don't know it. Do those have bad interactions? What's the risk benefit? What should I be gaining from this? And so it was empowering people for that. The other one was, do you have adult ADHD? When to know if it's stress and mental load versus actual.
I think I read that.
Yes. Again, inspired by my life. But like those sort of things too have been really powerful. So you can talk to your friends about it. You learn something, but also we want to build that better relationship with our doctors. And we've seen really good click-through rates too. Like we always have a subject matter expert and we always link to their profile. It's those types of articles we're seeing directly to that doctor because again, we're building that trust and now we've built a conversation that they can continue, which has been really cool to see.
Well, that's what people want. They just want somebody they can trust who will like tell them the thing to do. You know what I mean? I didn't go to medical school. Just tell me what's the right thing to do. You know what I mean? Thank you so much for joining me, Amanda. This was fantastic. What a great conversation. There's a lot to learn from you. And I hope other people will watch this and get as much out of it as I did. Thank you to our viewers for joining in. I hope you got the answer you needed today. If you have a burning question, put it in the comments or email it to ahava.leaktag@ahamediagroup.com. I will see you next time.